Okay, so I like to do that so that they don't have to struggle to stop them falling off the bed. Now, when he's lying like this, it's very difficult to find anything because he's in extension. So I would get them to just tuck your chin in. Okay, can you still breathe? Good. Can you adjust your position? Okay, so it's much easier than to palpate the structures in there. If I start from the occiput and down the midline, I know the first bony prominence I find is C2. Spinous process would be C2. If you're lucky, you can feel the bifidity, if that's a word, of it. Sometimes it just feels like one, like in this case. Okay. Now let's explore this. So when I'm going to push down on this, and the way that I tend to push down is I don't go for a kill. Sort of like, does that hurt? It will if you do it like that. So it's a gradual sort of, okay, sinking in, come off a bit, sinking in a bit more, come off again, and then explore how far can I go. Okay, so I'm interested in pain response. See if it triggers.
Sorry, when would you use your thumbs and when would you use that kind of part? Or is it
Thumbs in the morning.
Okay. Thumbs AM.
It depends on the area. So down here, if I'm palpating, I'll use my thumbs just to count things. If I was going to do some treatment, I would find it with my thumbs. Whenever I can, I would use this because these are small joints and you're going to do, the less you subject these to strain, the better because you will need them for all sorts of things. If you go to the unilateral ones, it gets much harder. You can't really use a Parsiform. So then I would tend to. But I will always try and avoid that sort of hyperextension of the thumbs. So if I'm using thumbs, I would often put two together, one supporting the other, so they don't hyperextend. Sometimes I would have one thumb on it and I would use a hand over it like that. So there are different ways you can do it. But look after your thumbs. Okay, back to here. So we found C2. So we're going to sink in, looking for pain response, any muscle activation that's triggered by it, stiffness. Okay. You okay with that? Any pain at all?
No.
It can be difficult to hear what they're saying in this sort of position, a bit muffled. And then I would work my way down. It gets harder to differentiate the spinous processes in the middle part of the cervical spine. But when you get to what you think is C6 and C7, there is a test you can do. So I'm holding on to a couple of spinous processes there, and if you lift your head up and back down again, okay, do that again, okay, and down again. So C6, when you do that extension, will go much deeper, so you can't palpate it. So I know that the one that remains palpable with that movement will be C7. So I'm pretty confident that I'm on C7 there, and C6 is just below there and disappears when you extend. Okay. Then we can do so that was a sort of central on the spinous processes. Then we can do unilateral, so just tuck your chin in again. You okay still? Yeah. Now you have some big muscles here, particularly the upper fibers of trapezius. So if you just push straight down here, there'll be lots of muscle bulk between your fingers and the bone. Now if you try and push that out of the way a bit, so I'm pushing it medially here with my thumb, and then I would come in and I can feel, it's more of a bony feel under my fingers. So you might want to look at the skeleton when you do this to see what it looks like. And then I would do the same thing, just gradually sinking into it, looking for pain response, any other muscle twitching or anything, and you can do that. Keep going down the spine. When you get further down, the slope of the trapezius muscle means that it's going to be in the way, so I tend to go more towards just to the lateral aspect of the spinous process again, pushing through the muscle more. Just exploring that. Okay, thank you.